FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome, and you are listening to the Financial Survival Network. I'm Kerry Lutz. It's January 31st, 2018. Where does the time go? Hey, speaking of time, this podcast is sponsored today. We have a new sponsor, Health IQ. And Health IQ is an insurance company that helps you, health-conscious people like runners, cyclists, weightlifters, and vegetarians get lower rates on your life insurance. For more info, go to healthiq.com/FSN and support the show. See if you qualify. Well, speaking of health, more importantly, perhaps, is your mental health. And at some point in all of your lives, myself included, there's a time when you might not be happy and you need to talk to somebody. You need to find somebody to help you get through a tough period of time. Well, hey, before we get started, though, as always, join the show. Email us at kl@kerrylutz.com. So we've got Dr. John Huber back with us now. Dr. Huber, hey, it's always great to have you on. So what do you do when you think maybe you need a therapist?
Well, when you think you need a therapist, Kerry, there's a couple of things. First of all, if you have insurance, one of the easiest things to do is just to call the helpline, customer service line on your insurance card. And that is a good way to go and start your search for a therapist or a psychologist. If you don't have one, or if you don't want to use your insurance, and there's some actually legitimate reasons to not do that, you could start by word of mouth, talking to your friends and see if they have somebody they recommend or that they know.
Mm-hmm. So word of mouth, probably better than just looking in a directory somewhere. But then again, really, who knows? How do you judge a good therapist or a good psychologist? It seems to me it's like knowing a good doctor or lawyer. Referrals generally work better.
Referrals generally work better. If you don't have referrals, there's some interesting research. One of them suggests that the most important thing when looking for a therapist or psychologist is not what their orientation is. Are they Freudian? Are they behavioralist? Are they cognitive behavioralist? Adlerian? That the most important thing is actually how long they've been practicing. Because if they've seen a lot of patients, they'll know when they need to step outside of their normal orientation, and you can get the best product and the best help from that individual. So what is a big enough time? Well, a lot of insurances that require a length of time before they'll let you be on their provider panel recommend at least 5 years. But that being said, it doesn't mean someone right out of graduate school can't help you.
Right. Well, somebody who's been doing it for a long time could be burned out, over the hill, or maybe not
exactly
up to the up on the state of the art, if you will, the newest methods, techniques, etc. Is psychology a field that's really changing, or is therapy like it was 3,000 years ago during the time of Socrates or Aristotle?
Well, therapy is always kind of an evolving science. Right now the research shows that probably the most important thing for your success beyond years of experience is the therapeutic relationship you have with your therapist. And in that sense, it's probably always been that way, whether it was 3,000 years ago or 3 months ago. What I find is the patients who do the best with me are the kind of people that come to me and later say, I really liked you when I first met you. I felt like we could go have a cup of coffee together and just talk about the weather kind of thing. And that's important because as you struggle with your issues, if you have any excuse not to deal with that problem and do what we call resistance, avoid dealing with your problem, when that arises, if you have that kind of relationship with that person, you're going to feel kind of obligated on a kind of friendship level to go and see that therapist. And that's oftentimes all you need to get you in the door. Because as you build the therapeutic relationship, the therapist is getting to know you, and all of a sudden you bring up the real reason why you're in therapy. And if it was easy for you to deal with, you wouldn't be at the therapist.
Right. Well, what are your odds of success when you go into therapy here? I hear all sorts of statistics, et cetera. Some people do well, many don't.
Well, there's about 10 or 15% that aren't going to do well with any therapist. And that's has to do with personality types and all different types of issues. If you've been hurt before by a therapist, which unfortunately we're humans and therapists make mistakes. And some therapists probably shouldn't be therapists, just like, we all know accountants who probably shouldn't be accountants. But that being said, the majority of people respond well to therapy over time. They tend to deal with their problems at a much quicker rate than if they just give time as an option. And probably the best model, if your problems are serious enough, your best outlook is if you do a combination actually of some kind of psychotropic medication with the therapy. If you just do medication, which a lot of people do because it's easy, I can just take a pill in the morning, things will start getting better, but when the pill stops, you're back where you were in the beginning. So the good thing about therapy is hopefully you're learning coping strategies and coping mechanisms and skills so that you don't have to, in theory, ever see your therapist again.
Wow. So, what about the time it takes? Because time is money. It seems like some people never stop seeing their therapist, doctor, and the therapist, they kind of become an annuity to their therapist, if you will. I'm not saying all by any stretch, but it seems to be rather commonplace, doesn't it?
Well, it is for some people. And in fact, therapy can be addictive. And that's an advantage of using insurance because they're always checking on us. Hey, have they met their treatment goals? How far do you think it's going to be before they actually meet their treatment goals? And you're looking at termination. If you're private pay, it's nice to have that safe place to go and vent your issues. I have had some amazing clients that, they were private pay and it was very difficult to terminate because they didn't want to. And they're like, look, I'm paying for this myself. And so what I eventually did is started stretching out. Instead of doing it every week, we went to every other week, then every 3 weeks, then once a month, every other month, and, kind of wean them off of me, so to speak.
Mm-hmm. Well, yeah, that's always the concern is, and I think, it happens. Like you said, there's always good therapists and bad ones, just like any other professional.
Yes.
But, some people feel like they might even be perhaps being taken advantage of, by prolonging the process, if you will.
Well, and I can understand that feeling, but part of what you have to look at too is, are you actually benefiting from going to see the therapist? That's a big key. I know I do forensic work, so I oftentimes get patients who are court ordered to see me because the judges know I can work with their probation officer and stuff like that. And sometimes we're not a good fit, and I'll go and talk with the probation officer and sometimes the judge and try to find a different therapist for that individual. But other times we're a good fit, and we deal with the patient's issues. I've got a gentleman who's been in therapy with me for a long time, and he got 5 years worth of probation. And, after about 18 months, we pretty much dealt with everything. So I talked with his probation officer, and what we did, instead of meeting, once a week, and then we send it out to every other week, but we got a hold of the probation officer and they allowed us to do every week. And then after about 6 months of that, we started saying, how about every 6 weeks? And the problem with that is the judge is like, no, because he wants a monthly checkup from me. Mm-hmm. So that's, but we know there's a dead end on this. In 5 years, when that time lapse is up, it's over. Unfortunately, the problem is, it's kind of like his probation fees every month. He has to pay me because the court's not going to pay them to do therapy. That's part of the consequences for the activity they did.
Understood. So it's a bit complicated. Hey, so FSN is now sponsored by Health IQ, which is an insurance company that helps health-conscious people like you get lower rates on your life insurance. You probably didn't know that people with a high health IQ are 42% less likely to be obese and have a 50% lower hospitalization rate than those with a low health IQ. Living an overall healthy lifestyle can lower your risk of cardiovascular disease and all causes of mortality by 57 to 60%. Physically active people such as myself, I bike ride, try to do 30, 40 miles a week, and I feel great, and I'm lowering my risk of heart disease by over half, as well as reducing the risk of cancer by 22% over those of you who are inactive. So if you're health conscious and want to save on your life insurance, go to healthiq.com/FSN. You heard it, healthiq.com/FSN. See if you qualify and start saving today. All right, we're talking with Dr. John Huber, clinical psychologist, and talking about building a relationship with a therapist, how you find a therapist, and whether you know it's right for you or not. You know, a lot of times, doctor, you think maybe you're getting better, but therapy, like anything else, is 2 steps forward, 1 back. Sometimes when you really think you're doing badly, that's when the process is working its best. So how do you know that it's working, really? It's not just that you're going to feel better necessarily, right?
You're not necessarily going to feel better, especially when you start doing introspection and working with your therapist. You might actually be kind of beating yourself up because, oh my God, you're facing problems and little things that aren't aligned with the perfect sense of who you are. The thing is, you're working on those. And an important thing to look at is sometimes we know we need therapy because our friends are saying, hey, maybe you should go talk to somebody. But sometimes we know therapy's working when your friends come over and say, dude, something's different. I like being around you now. You know, hey, let's maybe do more things together. It doesn't necessarily mean it's time to quit therapy, but it is kind of a benchmark to show you that, hey, even though I may not feel like it, my friends are seeing a difference. So this is working.
That's a good thing. So what is the goal of therapy when you started? What are you trying to accomplish here?
Well, it depends on why you come in. And also, believe it or not, it depends upon the therapeutic orientation. For example, with Freud, the psychodynamic, the goal of therapy is to bring the unconscious to the conscious level so you can deal with the catharsis or the emotional release that you've never been able to deal with. Now, that's kind of a broad, general, sweeping stroke in one shot, but most of the other theories in there, you bring a presenting problem into the therapist and say, this is what's going on in my life, and I want my life to be better. And I think if I fix this, it'll make my life better. Usually that presenting problem is just that. It's something relatively simple and not really that intense, kind of benign, but you can build a therapeutic relationship with that therapist. And when you feel comfortable and you're making progress on the presenting problem, then you go, well, doc, really what's been bothering me lately? And then you drop the bomb, the real reason why you're there in therapy. And it could be it could be interpersonal relationship issues, sexual issues, dating issues with your kids, your wife, intimate things that you just don't talk about to your friends and that kind of stuff.
So obviously in the relationship, there's got to be trust, right? Trust is kind of number one. And how does a patient know they can trust you? How do you establish that?
Well, I think one of the ways a patient can do that is by bringing in a simpler problem than what they really think they need therapy for. And usually we kind of do that unconsciously. I see my patients do that. Some of them do it intentionally, especially people who've gone to therapists and have been burned before. They'll bring a simple problem like time management. I'm having a hard time dealing with my kids' school schedule and my work projects that I'm having to do for work. And how can you bring that in and you start building a relationship and you kind of see how that therapist is, because some therapists, they're just not right for everybody. And I'm not right for everybody. So it's a good way to fill them out. So that's one of the easiest ways to build trust. Me as a therapist, on the professional side of it, my job is to give them unconditional positive regard. I'm not going to criticize them for the things they do. At the same time, my job is to be genuine and honest with them. So although I may not be criticizing the person, that person may say, well, well, that's the way you would do it, right? And if I'm being genuine and honest, I can't just be a yes person. I have to tell them what I think I would do in that situation. And patients may not like your answer because all of a sudden they're feeling like, oh, wait a minute, he doesn't like my answer. And what I find is more patients than not sit back and think, okay, he was totally honest with me. He didn't tell me I was doing my decision making wrong. He just showed me how he's doing his. And they usually come back stronger, and we can actually start working with things that way.
And interesting. What about the problem of people becoming too dependent upon their therapist, where it almost becomes like a parent-like relationship? How do we avoid that? And is it a bad thing?
It's not necessarily a bad thing, but at that point, you're kind of dependent upon the therapist to start drawing lines. As you deal with your problems, if you deal with what you come there originally to deal with, your presenting problem you've dealt with, now you're dealing with the real reason, and you reach that. The next thing should happen is your therapist should say, well, that unless there's something else, we're kind of finished with our thing here. Maybe we can meet again in a month and see how things are going and see how that is. And you may go away, and a month later you come in and say, yeah, no, I'm doing fine. I don't need to see you anymore. Mm-hmm. But you might also say, wait a minute, I've changed, but the rest of my world hasn't. My wife is still the same thing, and she's very frustrated with me because I'm doing things this way now, and it's making her life more difficult. Can you help me with that?
Right. So a lot of factors involved, a lot of complexities. And hey, what about when you've got a therapist who you're not connecting with, you don't really feel it's the right person? How do you gracefully bow out of that relationship?
Well, first thing I recommend is just don't show up. I mean, don't do that. That sends lots of messages. Plus, if you're using your insurance company, we're going to tell the insurance company that you just didn't show up, and that's going to make them less likely to approve you getting treatment from another therapist. So you want to talk with a therapist and say, I started here and I felt really good about things, but I just don't feel like I'm a good mix with you, and our personalities are colliding. Could you make a referral? Ask them outright for a referral to somebody. I do it all the time because I'll see a patient who comes in and I don't think the first visit that we're going to be good for each other, and I'll recommend a referral. And sometimes, believe it or not, I've actually had patients go, well, I really want to try it with you. I've read your reviews online, whatever. My insurance company says you're highly rated. Can we at least try it? And I've had some of those patients I thought would be bad with me actually be some of my best patients. So we're not always that insightful as therapists either. Sometimes the most difficult client becomes your favorite client.
Interesting. What about those reviews? Do you think, how much stock can you put in reviews, online reviews of any medical professional, not just a therapist?
Well, I have a massage therapist in my office and a couple other people who come in and out, and because I'm not in my office every day because I do hospital rounds, and they use and have used some of the more popular ones online where you pay a fee and that type of stuff. And I haven't found a good one in the sense that if somebody makes a complaint to you and say you go back and you talk to that person and you resolve that issue, I'm thinking of a specific service. I don't really want to slander anybody or put any name out there, but for the kind of money you put on there, you should be able to have some kind of response and restitution so people can see that. If you look at review companies online or otherwise, and people are making complaints and you don't see any responses from the people that they're getting their services from, I would step away from that review thinking, that this is awful one-sided. And it is sometimes for a reason, because I've seen them, and I know personally that people in my office have made responses and fixed issues. And when they go back to post them, they've been pulled down off the internet. So their ability to fix things doesn't help the people looking for reviews. So you're not necessarily getting an honest response from those reviews. And it's scary because we thought that was going to be, this will be great, a great way that we can sit there and get real responses. My best experience, and actually this past month, I've had several new clients have come in and they've gone, wow, the insurance company said a lot of good things about you.
Really?
And the interesting thing is, especially the way insurance is right now, they're getting feedback from their patients, their clients, after they're through getting services, whether it's a colonoscopy or any kind of minor surgery, major surgery, to something like therapy. They're like, hey, give us feedback. And you're going to get an honest rating from the insurance company, because they're not going to, they want their providers to be actually using their services and seeing their patients. So if they need problems, or if they have problems, a lot of times the insurance companies will actually go back and, hey, you're getting some complaints about your bedside service, and how your personality is in the surgical suite. And I hear that from the surgeons I work with at the medical hospitals I have privileges at.
Yeah, that's interesting, because it's very difficult for a layperson in choosing any type of professional, legal services, medical, you name it. It's really hard for you to judge. Just because somebody has a good bedside manner doesn't mean that they're doing the best for you that you need. In fact, it could be the opposite. And the idea of non-professional people reviewing professionals, it just oftentimes they don't understand. They don't really comprehend the entire process and what's involved here.
And that is so true. There's a lot of complex stuff going on. And sometimes, my job as a therapist is to call you on your bad behavior, essentially, for lack of a better term. And, I'm not there to be your friend. I'm there to be your therapist. You may not like what I have to say, because part of my job is to be genuine and honest with you. And that may tick you off. And so you spit out some response. They're horrible. But what they did may have been exactly what you needed.
Yeah, it's so true. Well, Doctor, it's really been great having you on again. Just tell us where we find you, best place to connect on the web.
Best place to connect on the web is mainstreammentalhealth.org. And I am working currently on a book. It won't be very long. It's relatively short at this point.
Best kind.
How to do this, how to find a therapist.
Oh, that's excellent. Well, it's much needed, because therapy doesn't come with an instruction manual, at least one that ordinary folks can understand. So I'm sure it'll be a real plus when it comes out. Hey, just be part of the show. Email us, kl@kerrylutz.com. We answer all. I'm only about 50 behind right now, but I will be catching up, spending the weekend answering you all. And hey, just check out the Twitter feed @KerryLutz and the Facebook page, Financial Survival Network. Doctor, thanks so much for coming on, and we'll talk to you again soon.
Thank you, Kerry.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.